whenever you order one of these tests, you want to know what you're going to do with the information even before you order the test. And it needs to have an actionable result in order for that test to be valuable. And in patients who are non-metastatic, traditional non-metastatic castration-resistant prostate cancer, we know based on a trial from a Spartan-like population that 55% of these patients actually had M1 disease when they were scanned using PSMA. But the truth is those patients were actually included in Spartan based on their bone scan and CT, and they still had that 2-year improvement in METs-free survival. So I think what we need to do is we need to make sure we stay true to the data and stay true to the trials that have been published and have been vetted. Because the only way you could replicate results from a clinical trial is to replicate it in real life as closely as possible. So that's one message I think I'd like to convey. And the other message is patients with castration-resistant prostate cancer have aggressive disease. PSA obviously is a very important biomarker, but we know that patients will have progression even without a rise in PSA. And we know this from the PREVAIL data that Dr. Bryce published on that showed that 25% of patients actually had radiographic progression without a rise in PSA. So castration-resistant prostate cancer patients are obviously very aggressive, have very aggressive disease, so it's important for us to continue to closely monitor those patients as well.